Thank you, Mr. Speaker. I rise today as a father, an American, and a Congressman in support of H.R. 1425, the Patient Protection and Affordable Care Enhancement Act. I rise today as a father because health care is personal. I know the pain of caring for a sick child. My daughter Pia was diagnosed with Hodgkin's lymphoma when she was just 14 years old. Parents and children who have been through the fear, the hospitalizations, the chemotherapy, and the years of anxiety-evoking follow-ups know the nightmare all too well because they have lived it. But Pia and our family are among the lucky ones. She survived cancer and is now a thriving 20-year-old pursuing her college studies. And I know how lucky I was to be at Pia's bedside during the toughest days and to do so without worrying about how I was going to pay her medical bills. I know, in fact, we all know, that this is not the case for too many American families throughout our country. We need this legislation because it will lower healthcare costs, costs that are the very highest in the entire world. And yet, our outcomes are mid-pack. In the United States of America, we should have the highest quality care in the world, the most efficient delivery of care in the world, and the best value in the world. And in the United States of America, the wealthiest nation in the entire world, no one should have to choose between seeing their doctor or seeing food on their table. No one. I rise today as an American because healthcare is patriotic. I am sick and tired of Americans paying more money for less quality than other nations. And I'm sick and tired of Americans paying more money for the very same life-saving medications than patients in other countries. Americans are getting ripped off, and we, every single one of us in this chamber, can do something about it. Ensuring that every American has access to high-quality and affordable health care and medications is indeed a moral decision, but it is also an economic decision. Let's not kid ourselves. We do not have a health care system in our country. We have a sick care system. And it's not even a system, which has made the epic failure of our nation's COVID response even more glaring. You see, we tolerate, even condone incentives for procedures over prevention and profit over people. And it's costing us billions of dollars and bankrupting thousands of families and surely costing American lives. We need this legislation because there is meaningful economic and societal value in ensuring that every American enjoys health care coverage, no matter their age, their race, their gender, their zip code, their income, or their condition. And I rise today as a Congressman because finding common ground, building consensus, and fixing our broken healthcare system is my job. I'm on a mission to inspire collaboration in this chamber, restore Americans' faith in government, and I cannot imagine a better place to begin than healthcare. So let's rise to this moment and improve it together. Colleagues, we need this legislation because it will help all Americans, not red state or blue state Americans, but all Americans. We need this legislation because no one in this country, Republican, Democrat, Independent, or otherwise, thinks that our healthcare system is working. We need this legislation because healthcare is collective, and this pandemic presents an extraordinary opportunity to build a true health system in this country. COVID-19 has taught us that one's health and well-being are directly dependent on the health and well-being of one's entire community. We're in this together, my friends, and we must take care of one another together. We need this legislation because whether it's my daughter Pia, a cancer survivor, or Cindy with diabetes in Eden Prairie, or Nikki with MS in Brooklyn Park, or every single mother in our country who has ever given birth to a child, pre-existing conditions are part of being human and should never be a barrier to care. We need to pass this legislation because it is personal, it is patriotic, and it is our job. I'm grateful to my colleagues in this House for doing so yesterday, and I call on our colleagues in the Senate to join us in ensuring a healthier and more equitable future for every single American. I yield back.